Welcome back. We've done four episodes on the cranial nerve so far, and this is part 5. We've gone through cranial nerves 1 through to 6. We're just it's a bit weird because some of them work together. We've gone back to 5, which is the trigeminal, and we've split that into 3 separate sessions because that one's quite complicated. Hopefully we'll finish that today. I'm fingers crossed. I'm pretty positive that we will. And then we're going on to the facial nerve. We'll do a little bit of a recap and then we'll crack on. Here we go. So this is from the summary table that I've done for the cranial nerves. You've got basically all of the cranial nerves 1 to 12. Then you've got where they come out in the skull, the exit points in the skull. Then you've got what they're called, and in brackets is a little mnemonic to help you remember what they're called. So when you get into your exam, you can write that mnemonic down. And then here we've got what they do. So we've got sensory, motor, or both. So it's either S or M or B. And again, another little mnemonic to remember that. Then you've got what they do. And then you've got how you test them. You've got all the cranial nerves on there. Let me go back to this one. So what I've done is I've extracted a section of that summary table and put it onto the slides that are for the individual nerves. So today we're finishing off the last section of the trigeminal nerve. So this is nerve number 5. They're all in Roman numerals if you've not done this one before. We've got 3 different exit points in the skull, depending on which nerve you're looking at. We've got the superior orbital fissure, which is just behind your eyeball. The foramen rotundum, which again is just behind your eyeball, but a little bit lower than the fissure. And then this last one that we're going to have a look at, which is the foramen ovale, an oval shaped hole. We've got the different names of each of the 3 branches. We've got the ophthalmic, the maxillary, and the mandibular. We've had a look at ophthalmic and maxillary, and now we're going to have a look at the mandibular and how that gets sensation to around the bottom part of your face. This is sensory, well, if it's sensory, motor, or both, this is a B, so this is both. All 3 provide sensation to the skin, but this last one, the mandibular, also provides special visceral motor, so we'll have a look at what that means today. So what do they do? Sensation to the face, and then the motor for the mastication muscles, so muscles of mastication, which is chewing. And then the test that we can do clinically if we think that there's a problem with the trigeminal nerve is a sensation test to the face. And we're going to wrap that all up and have a look at that as well today. On these slides as well, we've got the number of the cranial nerve, we've got what it's called and whether it's motor, sensory, or both, what type of sensation or motor, so general somatic sensory and special visceral motor, so that's what this one does. And then this is the mnemonic for whether it's sensory, motor, or both. Some say money matters, but my brother says big biceps matter more. And basically, there are obviously 12 things in this mnemonic. So this is cranial nerve 1, 2, 3, 4, 5. So cranial nerve 5, trigeminal is butt. Again, you can write that out in your exam if you're doing that, and you will know that the trigeminal nerve is both motor and sensory. All you've got to do then is remember which bits it does. Easy. Let's have a look at this. The top 2 branches, again, just a bit of a recap. These are purely sensory, and then the bottom branch is sensory and motor. We've covered ophthalmic and maxillary. We're now going into mandibular, and if you look, it's trigeminal because it's 3 nerves, 3 branches, and they are often given a little letter and number after the name of the nerve. So V1, V2, V3. We've had a look at V1, V2. We're now looking at cranial nerve 5, number 3. Sensation to the face, the nasal cavity, the cheeks, the lips, the skin of the mandible, and motor for the muscles of mastication, the anterior belly of the digastric, which is one of the muscles in your throat, or the kind of floor of your jaw, and then the mylohyoid muscle as well. And we did a whole session on the hyoid bone and the hyoid muscles. So if you want to know a bit more about those, then have a look at that video. So that is those. The order in which the cranial nerves emerge are the reasons for the order of their numbers. Cranial nerve 1, the olfactory nerve, that is closest to the front of the brain. So that is given number 1, and then number 2 is the optic, and that's the next one back, and then so on and so on. We're on cranial nerve 5, so from anterior to posterior, so from front to back, this is the 5th one along. Okay, and this is just another, this is a kind of thing that you'll see in textbooks showing you what those nerves do. Again, very, very briefly, I'm not going to cover these in too much detail because we've already done it in lots of detail. So the ophthalmic is sensory for the skin of the upper eyelids, all this kind of green area here. It also is for the lacrimal glands, for tear production, the nasal cavity, the nose, the forehead, anterior scalp. Okay, so all around that region. And this is where it goes through. If you take the brain out of a skull and then you're left with the shelf that the brain sits on, then there are lots of little holes, and you might not have realised there are so many holes before when you've looked at a skull, but there are, and there are nerves and there are blood vessels that go through these holes and then supply the face and the neck. So yeah, there's a hole for everything basically. Usually they follow the same pathway. Obviously there will be some variations in shape and size, as they usually are, but basically this is where they go. Superior orbital fissure is the ophthalmic branch, so that was the one that is just behind your eyeball. There's your eye socket, and that's where that nerve emerges through there. This is from the book Instant Anatomy, and apologies if this freaks you out if you've not done the previous sessions, but go back to those sessions and have a look. We've got all the different branches of that ophthalmic nerve, and then what they do, what they innervate, or the sensation in this example, where they provide sensation for. Frontal branch, forehead sensation, and then you've got these branches here that's for the nose and around the eyes. We've done a whole session on that. Then we moved on to the maxillary, which is this pink zone here. That's the sensation for the nasal mucosa, so the mucus at the back of the nose, or that kind of mucus producing membrane. And then the palate, the roof of the mouth, the pharynx, the upper teeth, all around here. Remember I was saying last time, my wife had a head injury. She had 4 eye socket fractures, and she has lost sensation to the palate and her upper teeth and the mucosa of her nose. Immediately, as soon as we went to any kind of ENT specialist, they knew exactly which branch had been affected with the kind of symptoms that she was getting. We're just starting to creep down into the lower part of the face. There's a bit of a crossover with these. When you're doing your testing, you need to test all of them basically. Oh yeah, that must be that one, because there is some crossover in certain areas. This is where the maxillary branch goes through. There's the foramen rotundum, which means round hole, and it's just below the superior orbital fissure. There's the fissure that the ophthalmic branch comes through, and there's a tiny little hole there where the foramen rotundum is, and that's where it comes out there. And we did this all last week. There's another schematic. That one was like super complicated. There was quite a few blown heads, I think, with that one. There's zygomatic, infraorbital branches, nasopalatine branches, and the names give away sometimes where they provide sensation for. So nasopalatine, nose and palate. You can kind of get an idea about where these things go to. That's that one, and then and now we're on to this one. We're on to the last one. We're on to the blue section now, which is this area here. This is the 3rd branch of the trigeminal nerve, and it's called the mandibular. And what time is it? Yeah, hopefully get this done, and then we can start on the facial nerve, because that's a really interesting one because of a condition that was mentioned a few weeks ago called Bell's palsy. And you'll see when we start going into the facial nerve why Bell's palsy does what it does. Yeah, it will give you some. It's just obvious, basically. Once you have a look at it, we've got this blue section up here, all of the temple kind of area just here, so on top of just to the front of the ear, down where the temporomandibular joint is, so where your TMJ is over that region, and then all the way down to the lower lip, and then into the neck as well, around that area, all along the line of the mandible, basically. This has sensory and motor components to it. Sensory for the anterior 2/3 of the tongue, the front 2/3 of the tongue, the cheek, inside and outside of the cheek. If you're losing sensation to the cheek, then there may be a problem with the mandibular branch. Lower teeth, it's all here, and in my wife they're fine, no problem with those. It's all upper, it's all those. Skin over the jaw, the side of the head, anterior to the ear, so that temple region, and then the floor of the mouth, under the tongue kind of area. And then motor, muscles of mastication and the villi palatini, the soft palate muscles, and then something called the tensor tympani, which is in the middle ear. There's some contributions from the trigeminal nerve into the auricular canal, your ear roll, basically. That's what this does. Let's have a look. This is the schematic for the mandibular section. Those previous two slides, they're all the same nerve. This is the crazy thing with the trigeminal, that it just does so much. It's really difficult to remember what each bit does, and you wouldn't necessarily need to know the ins and outs of everything. There are some very simple tests that you can do, because the key thing that we need to test is the sensation of the face for the trigeminal nerve. I'll show you that before we move on to the videos. These are the main branches that we're going to have a look at today of this mandibular. We've got the anterior division. This supplies the muscles of mastication and sensation to the cheek. If you have a look here, there are these little branches that come off here, and you can see where they all go. And you can see this like little squiggly line here. Hopefully you can see that if you're on a big enough screen. This is the mandible. We've got sections of this branch that travel through the bone. They literally go into the bone and then go through it and then pop out somewhere else. So they use it like a bit of a tunnel network. And we saw that in the maxillary branch as well, around the eye socket area. Some of the nerves are protected because they're in the bone. They're inside it. We've got the lingual branch. This is sensation to the tongue, the gums, and the floor of the mouth. That's that one there, that region there. So you can track it, and you can see where this is going to. You'll see this one again when we come to the facial. There's a bit of a join with this one and the facial nerve. All right, they work together. So that chorda tympani. Okay, just keep that in mind when we get to the facial. We've got the inferior alveolar, sensation to the teeth, the lip, and the upper chin. And again, if you follow that down, you can see the lower teeth. And then that goes into see these bits here on these diagrams where it's got the circle around. These are holes, basically, that they emerge from. So this then becomes the mental nerve, or the mental branch. And this provides sensation to the chin and the lower lip. There's a specific exit point around here, and then the nerve pops out and then supplies all that region there. We'll have a look at that. And then the mylohyoid. So this is motor to the mylohyoid muscle. Again, we covered all the hyoid muscles in another video. And the digastric. Again, floor of the mouth muscles, ones that attach to the hyoid bone, onto the bottom of the mandible, and then up into the styloid, which is, or stylohyoid, which is up by the mastoid process just behind your ear. So again, we covered all of those on the hyoid. So if you've not heard of any of those before, then we've got videos for all of those too. This is where the mandibular branch of the trigeminal comes through. We saw the superior orbital fissure. That's where the ophthalmic one went through. Then we saw the foramen rotundum, which is the round hole. Foramen ovale is oval hole. This is an oval shaped hole just here, and then it pops out just around about there. So you can see it's fairly close to the mandible, to that jaw, as it makes its exit. That bit there is the zygomatic arch, basically your cheekbones. So it's right, if you could put your finger in, you kind of push it into your cheek and then push backwards towards the back of your skull. There's going to be quite a deep dissection on this one, so be prepared to see someone's face. So it's obvious with this area, but it can be a bit shocking. These are the tests that we do. for this is dead simple. The only problem is the reliability of the testing, really, because you basically make like a little wisp on the end of a cotton wool ball, and then you brush it lightly all over the face. The only problem is the pressure that you use to press. So if you're really light, you could get a false positive. You need to try to get as even a contact as possible. And the way that I do this is I kind of rub all the way around the face and then up and down everywhere, so that you've got something to compare to as well. And it doesn't matter which order you do it in. I would usually test the affected section last, so that they can get the idea of what it should feel like, and then you go to the area that's been affected. So yeah, little wisp of cotton wool, and then you basically just rub it all around the face. So we're testing the sensation for the face, and that's the cranial nerve test for the trigeminal nerve, and that's all of them. So all of that complexity that we've gone into over the last couple of weeks, that's the test. But at least you know where the nerves are coming through and exactly what they do. Let's have a look at this. Get ready by the pause button. Here we go. Yep, so at least I got the right video. So mandibular part of the trigeminal nerves. This was the image that I put on the slides. It starts here, the foramen ovale. Can you see that there? You can see that's an exit point. There's another little exit point there. Where's the next one? Down here, and then another one down here. You can see it travels through stuff. Yeah, so it's going to go down a little way, then it's going to go through a hole, and then it's going to pass through a bit of bone, and then it's going to pop out of another hole, so that you can, well, we'll explore all of the pathway of all of these. So some of them are really tiny, so you're not going to be able to see them very well, but some of them are pretty chunky and they're easy to see. So we're going to follow the main branches of this nerve as we go through. So any questions as we go, if you want to go over anything again, then just let me know in the messages and I'll cover stuff again. Again, what I've tried to do with the videos is bring in the summary table. Okay, so all of the stuff that we've just looked at is here, and this will run throughout the whole video. So you've got this as a reference all the way through. So we're looking at this branch here, branch 3. The foramen ovale is the exit point. See that bit there? That's your superior orbital fissure. This is the shelf that your brain sits on. All right, that one there, foramen rotundum. There's the fissure, there's the rotundum just underneath, and then this one here, foramen ovale. Those three areas, that they all come from one, I call it a ganglion, where there's like a swelling of nerve tissue, and then it splits into 3, the trigeminal nerve, boom, and then one goes through superior orbital fissure, one through the rotundum, one through the ovale. Okay, so let's have a look at that. Here we go. So there's the fissure. So that's where your ophthalmic goes through. That's where your maxillary will go through, just there. And then there's your ovale. And if I just pause that there. So this is a zoomed in section of that big schematic that we saw earlier. So that's the foramen ovale. And you can see that this is where it exits the skull, basically. That's the first, like, top left corner of that original picture. And here we go. So if you haven't seen the videos before, this is now inside the skull. So that same area where the brain has been taken away so that we can see underneath. And there's the ganglion for the trigeminal nerve. So you can see it's quite thickened just here. And then you've got the branch over the top, which is the ophthalmic. That will go through the superior orbital fissure. Then the next one along is the maxillary, and that will go through the foramen rotundum. And then this one down here is the one we're interested in today. So this will be the mandibular. Keep your eye on those too, but we're focusing on this one for this particular session today. Okay, so there's your ophthalmic. There's your maxillary. And then the one we're interested in today, hopefully. So that's where it goes through, foramen rotundum, which is just there. And then there's the mandibular. So that's heading down towards the jaw. And then there's your hole again. Okay, so foramen ovale, so the mandibular goes through here. okay, which is that bit there on that big picture, which correlates with this here, okay. Hopefully it's all starting to make sense once you've done 3 weeks worth of trigeminal nerve. This is where it's popping through, just there. There's the foramen ovale again, and you can see as soon as it pops through, we've then got these different branches, and they start to then go off to different things, okay. There's the back teeth, so we'll just stick to the back teeth of this. So we've got the molar right at the back, so it's right in there. That's where it's coming out, that area there. And now, I did warn you, side of someone's face. This here, that's where your ear would be. That's the hole for your ear, basically your auditory meatus. And then that there is where your TMJ would go. You can see that bit of bone there? That's the mandible. And that's where they've basically just taken a bit of the mandible off. They've taken away where it attaches into the skull so that you can see behind it. So it's these nerves that we're going to be interested in a second. If I just pause that there. So there's the mandibular nerve coming through. There's the foramen ovale on the original picture, and that's where it's coming through there. All of these branches coming off here, they're not, I've said this before, so that this drawing is not accurate. Yeah, it's just laid out in a nice simple way so that you can see where everything goes. But it doesn't necessarily mean that this one comes off first, that one second, that one third, and so on and so on. It's just laid out in that way so that it's easier to see. So that's the area we're looking at as it's just emerging from that foramen ovale, and then it splits off into loads of different areas. So let's have a look at that. Yeah, so there's your foramen ovale, and those are your motor branches. Okay, so the motor branches are this anterior division. We've got basically, see it as it comes down a little bit there, and then it goes, and then it nicks off all of those branches there. These are those branches. They supply the temporalis, the masseter, and the pterygoids. And so temporalis is this muscle here on the side of your head. If you clench your teeth, then you can feel the temporalis muscle engage. That's that one there. If you can feel that, then your mandibular branch of your trigeminal is good. The masseter is just here, where your angle of your jaw is. If you just put your finger just in the squishy bit there and then clench your teeth, you should be able to feel the masseter muscle push your finger away. That's the masseter. And then the pterygoids are deep to that, so you'd have to go inside your mouth to get to that one. I'll let you do that. So these are the motor branches that part of the nerve supplies, or the muscles that part of the nerve supplies. We've also got these little branches here, and again, like I said, some of them you can't see very well, but these go off towards the ear. Well, you've got one to the palate, one to the ear. That was the tensor tympani that we were talking about previously. Okay, so part to the middle ear. So it's quite a thick nerve, this one. We've got this branch here, the buccal, so you can see that coming down here, and then that supplies all of these muscles around the lip and the mouth. Let me just play that through. Yep, so you got the buccal nerve there, and that provides sensation inside cheek and outside of cheek. This one here, auriculotemporal nerve. So coming up there, so you can see the ear there, and then that's where the TMJ would be. This one is supplying the skin around the temple. It kind of comes down and then wraps around and then provides sensation to there. So if you remember that image at the beginning with the green zone where it was all around here, yeah, so that's part of that sensation. So auriculo is ear, temporal bone. Okay, so auriculotemporal nerve supplies sensation to that area. That's where the mandible will be, and then that's where it supplies all around there. Now this is where it gets really cool. You've got this, there's your medial pterygoid muscle. This is one that's on the inside of your mouth, and the nerve lies on top of it. You can see it's deep to that, and then there's your mandible just there. So this is one of your alveolar nerves, and you can see it's quite a big nerve. This one is just about to take an interesting journey. Just play that through. So there's your inferior alveolar nerve, and what I've tried to do as well is link up these. So this is the lingual nerve. Link these up with the diagram so you can see where they correspond with. Okay, so that's lingual. That's the inferior alveolar. This is really cool. We've got some interesting pathways. So the lingual nerve, this is going inside the jaw. We're going to have a look at those in a second. So that's where your medial pterygoid attaches. Okay, so on the inside of the angle of the mandible, so right in and down. And like I said last week, did some training on how to do some manual therapy for that area for people with problems with lockjaw, if you can get the mouth open that wide, and amazing results. TMJ problems, you obviously have to get permission to do any internal work, so even in the mouth, so you have to make sure that the patient's okay with it. Obviously wear gloves, but you can use the same kind of techniques that you would use on any other muscle when you can do them intraorally. Okay, so obviously you can't just have a play around. You need to learn off someone who knows what they're doing, but you can do it on yourself, no problem. Let's have a look at where this goes. Yeah, there's your mandible. Okay, here's your inferior alveolar nerve just coming through here, and then this takes a dive into the mandible. Okay, so there's a little mandible foramen, so a mandible hole, and that's where it goes into. And you'll see this in a second. What they'll do is they'll start to take some of the mandible away. There we go. And that's where it goes. Okay, so it actually sits in the mandible. Okay, so that inferior alveolar nerve goes into the mandible and then goes all the way along it, and you can see where it supplies here, so all the lower teeth, and then it goes toward, and then it comes out as the mental nerve, and then supplies the lower lip and the chin. Okay, so it's fascinating, this one. Okay, so there's a mandibular canal, so it's like a groove. Imagine being the first person to come up with this. And then you've got the mylohyoid branch as well. This is going off towards the mylohyoid muscles and the digastric as well, I think. Yeah, so mylohyoid and anterior digastric, yeah. As it goes through, let me just pause that there, because this just looks like a mass of horribleness. That is the mandible. That's the side of your jaw. They've channeled a groove so that you can see this this nerve coming through here. Okay. Is it unique to this nerve? Do you mean going into the bone, that being unique? Because there is another branch of the maxillary nerve that goes through the eye socket and then pops out on the front of your face. Okay, so there are a couple in the face. It provides sensation to the. Can you see these branches? So that's sensation to the gums and the lower teeth. Yeah, you can see if you get a whack on the TMJ, it can make all of your bottom teeth go numb, and your gums. And then that bit there is the mental nerve. If we have a look at that, that's that bit there. Yeah, that's right, Stevie. Yeah, so that there are there are branches off the maxillary nerve that travel through the bottom of the orbit, the eye socket, and they then emerge on the front of the face around here. Okay, so you can have a look at those. I think that was in the last section. That bit there, and this is sometimes really tender, so you might be able to find a point on your chin. Oh, I think it's there, and it's really quite sensitive, and that's where the mental nerve comes out. That then, so it's travelled through the bone, and then it's popped out as the mental nerve, which then supplies the sensation for the skin of the lower lip and the chin. Okay, I think this is a brilliant one, this one. It pops out there and you can see it coming through the bone there, so it's all that region there, the lower lip and the chin. This is the lingual nerve coming down here, and then there's the inferior alveolar, which we've looked at before. There's the buccinator muscle, and then they've taken that away, and you, again, apologies, you can see the teeth, but this lingual nerve runs along the kind of inside line of your mandible and along the side of your tongue. It's coming around that area there. So that's where your mandible would be. So they're just taking that away so you can see it a little bit better. Yeah, so there's the side of your tongue just there. So this branch here, this lingual branch, this is the bit that supplies sensation to the anterior 2/3 of your tongue. And you can see exactly where it goes and why it does what it does. There we go, as it goes through. Okay, and there's another little bit of a branch up there. It's kind of like a thickening of the ganglion there, and that's the chorda tympani. So the chorda tympani, and this is what we were saying before. Look out for this one when we do the facial nerve, okay? Because it joins up with the facial nerve later. So yeah, we've got floor of the mouth, anterior 2/3 of the tongue. Taste, yeah, so taste sensation. Okay, so that's what that does, and then there's another branch from the facial nerve that does all that too. Again, lingual nerve, side of the tongue, and they just keep on taking layer and layer and layer, and there it goes. So that's it inserting into the bottom of your tongue. Okay, so it supplies that front 2/3 of your tongue. Cool. That's ace, that one. I love that where it goes through the bone. I think that's really, really cool. And that's it for the trigeminal nerve. That's all of them. So there's a few things that you can test. Obviously, the motor part of it is the masseter and the temporalis. So that'll be the mandibular branch, and then everything else is then sensory. You just test sensation for the face, and that's one of the ways to do it. Okay, so we've got light touch there for the face. So that's the trigeminal nerve done. Okay, if anybody's got any questions, then you can give us a shout. We've got a few minutes left, so I'm going to introduce the facial nerve, and then we'll look at finish it. Well, we will finish that off next week. It's nowhere near as complicated as the trigeminal, thank God. Okay, so we should be able to tick off a few more of the cranial nerves next week. Anatomy induced body shudder. Yeah. There's when you're dealing with the face, it's a bit like ooh. Yeah, it's a bit close to the bone, isn't it? Okay, so again, this is from that summary table. So facial nerve is nerve number 7. You think, hold on, you've skipped one there because you were just doing 5. That's because number 6 works with 3 and 4. We did those ones together, and now we're going back to 7. It's just what they do. It's easier to group them that way. We've got skull exit points, internal acoustic meatus. Okay, so you can maybe hazard a guess at what that might be related to, something to do with hearing. And then we've got stylomastoid foramen. We've heard of the mastoid process, we've heard of the styloid, but hopefully we should kind of guess where that region is there. So the facial nerve has a couple of exit points, basically. It goes through one in that shelf of the skull, and then it travels through the skull and then pops out near your ear roll. That's why it's got a couple of exit points. Then the name of it is facial, Is it sensory? Is it motor? Is it both? It's B, so it's both. And we've got some say money matters, but my brother. 1, 2, 3, 4, 5, 6, 7. So it's the 7th cranial nerve. Yeah. What does it do? Muscles of facial expression and also sensation to the tongue. So remember we were talking about the chorda tympani before? Yeah, that's that bit where it joins forces with the trigeminal nerve. And what's the test is muscles of facial expression. This is why if you have a problem with the facial nerve on one side, it can look like you're having a stroke because you will lose control over that side of your face. So if you've ever looked at, or if you've ever done first aid before, you may have heard of the FAST test for strokes, which is the face, arm, speech, and then time. You get someone to smile and you see whether there's an asymmetrical smile. You then raise their arms and one arm will drop if it's positive. And then their speech may be slurred. It may sound as if they're a bit drunk if they're having a stroke. And then time is, if any of those symptoms are present, then you have to get them to hospital as soon as possible. So with a problem with the facial nerve, if you do the FAST test, you get them to smile and there'll be an asymmetrical smile. So you think, bloody hell, they might be having a stroke. You do the arm test, but the arms are fine. Yeah, you do the slurred speech test and they're fine. So you've got one of the three. I'd still send them to hospital thinking that they might have a stroke. However, it's less likely because it hasn't affected their arms or their speech. Because remember, this is a motor nerve to the face and that's all it will affect. That's just something to look out for. We've got a couple of different things that this will do. We've got somatic function, so I can choose to smile. And then you've also got autonomic or involuntary function as well. It does both the autonomic nervous system and the somatic nervous system as well. I'll just introduce you to this. Yay! And then we'll call it a day for today. I'll let you have a look at these in a bit more detail. We've got greater protrosal nerve. This is parasympathetic to the lacrimal gland and the taste buds. And that's the parasympathetic section of the nerve. And we've got submandibular branches for and this bit as well, for taste and the salivary glands. This submandibular, and look there, chorda tympani. So that joins with the trigeminal to provide taste sensation to the anterior 2/3 of the tongue. We've got the temporal branch, which is the muscles of the eyes. So you might have heard of some of these, like orbicularis oculi. So you've seen those anatomy pictures with the circles around the eyes with the muscles. So that's what this cranial nerve does. The temporal muscles of the eyes and the forehead. This might be useful for Botox. Okay, so if you've ever had Botox done, these are the muscles that they target. Zygomatic is eye muscles as well, orbicularis oculi. The buccal, upper lip muscles. I can't do that on the other side so well, but all of those muscles that do that kind of action. And then the mandibular, so the lower lip muscles, okay, depressors of the lip. And then we've got this area here, the cervical branch is the platysma. So this is the what are they called? The adverts where they did those animated animals, and you had the tortoise, and if you do a tortoise neck, that's your platysma just there. Okay, and there's no way you're going to forget that now. The platysma is from the facial nerve. So that big kind of sheet of muscle that covers here is innervated by the cervical branch of the facial nerve. We've got some other little branches off here as well. So the stapedius muscle, this is the smallest muscle in your body and is in your ear. And then you've got some other ear muscles and then also down into the bottom of your mouth as well. Okay, so that's where we're going next week. Have a look at all those, just kind of familiarise yourself with the names, and then we'll take a bit of a dive into the facial nerve.